Good morning. My name is Carol Shields from Philadelphia in the United States. I have no financial disclosures. I'd like to talk to you about Retinoblastoma 2022. And I'd like to thank all of my co-workers over the past several years. It takes a village to manage one case of retinoblastoma, and we've been doing this for over 50 years at Wills Eye Hospital in Philadelphia. It's all about chemotherapy for retinoblastoma nowadays. Chemotherapy in many different ways of delivery. And I will talk to you about this in the first section of my talk. We still manage retinoblastoma with enucleation if there's no hope for any vision or the family is unreliable or chemotherapy is not available. We use intravenous chemotherapy for bilateral retinoblastoma, intraarterial for unilateral retinoblastoma, intraaqueous or cameral for vitreous or anterior chamber seeds, and then plaque radiotherapy if the above fails. So what about intravenous chemotherapy? Well, intravenous chemotherapy can treat the eyes, the brain, and systemically. So it's treating the entire body. And this is good for high-risk retinoblastoma. Here we see a child we saw over 20 years ago. She had total retinal detachment in both eyes with large retinoblastomas, OU. She was treated with intravenous chemotherapy. The tumors regressed and both eyes showed flat retina. And this is lasting up until 20 years of age. Her visual acuity was 20/30 right eye and 20/70 left eye. No metastatic disease. So how long does intravenous chemotherapy last for retinoblastoma? To answer that question, we did an analysis where we looked at long-term 20-year real-world outcomes of intravenous chemotherapy for nearly 1,000 eyes at our center. We published this in the British Journal of Ophthalmology 2020. We divided the eyes into groups A, B, C, D, and E based on the international classification of retinoblastoma. We were successful in globe salvage in 96% of group A, 93% group B and C, and then less in group D, 78% and 47% for group E. But let's look at what happened year by year. This is at 1 year. At 2 years, it remains about the same. At 3 years, still about the same. At 5 years, still the same. 10 years, about the same. 20 years, about the same. So yes, intravenous chemotherapy, even though we only give it for 6 months, is lasting up until 20 years using Kaplan-Meier analysis. So what you see at 2 to 3 years is pretty much what you're going to see down the road. Now, how often do we need intraarterial chemotherapy in this cohort or plaque radiotherapy? About 20% of the time for IAC and about 20% of the time for plaque radiation. We usually give IAC first, mean interval 5 months, plaque radiotherapy after, mean interval 13 months. So I like to round it up to about 20% will need these additional interventions. Now, what about IAC? Well, I'm not going to talk about it right now. We use this every week, multiple patients, but we'll talk about this in the next session. How about intravitreous chemotherapy? Well, this is used for vitreous seeding. Here's a patient who had extensive vitreous seeding from a small underlying retinoblastoma, and after intravitreal chemotherapy, 6 injections, all the seeds cleared up, and we have a fovea left. On average, we only need 4 injections, and we use melphalan and or topotecan. In this publication from the journal Retina 2016, we found 100% tumor control with intravitreous injection of chemotherapy for vitreous seeding. In this publication by Francis et al., where she collaborated with 10 retinoblastoma centers in North and South America, including ours, we found no extraocular seeding if you do the injection correctly. Moving on, an important topic, unilateral retinoblastoma. How often is this germline mutation? Well, we looked at 482 consecutive patients who came to see us with one tumor in one eye, solitary unilateral retinoblastoma. In the literature, it says 15% of those patients are germline, but it's more than that. It depends on their age. If they're really young, 0 to 3 months of age, it's a 61% chance they're going to have germline mutation. And in the first year of life thereafter, it's about a 20% chance. And then in the second year of life, it's about a 10% chance they're a germline mutation. I thought this was an important analysis, and we published this in the Journal of Pediatric Ophthalmology and Strabismus this year. And our last topic, retinocytoma. How often does that transform into retinoblastoma? Here you see a plate of 6 eyes with retinocytoma retinoma. We looked at the Kaplan-Meier rate of transformation into active retinoblastoma, and at 5 years, it was low, 7%, 10 years, 11%, and it remained steady at 20 years, 11%. So it's a low risk for transformation. Here's one where it happened. This patient had a chronic retinocytoma that showed at the arrows growth into retinoblastoma. So we follow these benign tumors twice yearly for life. This was published in the Journal of the American Association of Pediatric Ophthalmology and Strabismus 2021. And in conclusion, how do we feel? How does the patient feel, and how do the parents feel? In a nice analysis out of the Indian Journal of Ophthalmology 2021, they looked at health-related quality of life, physical, emotional, social, and school quality of life. And they found children with retinoblastoma have lower quality of life than their siblings, especially in the physical domain and the social domain. We looked at the parents. Published in the American Journal of Ophthalmology 2019, we looked at depression, anxiety, and stress in parents of children with retinoblastoma and found the majority of parents had depression, 73%, anxiety, 64%, or stress, 100%. And if the child had bilateral or multifocal disease, the stress, the depression was greater. And if they had a history of depression and less education, it was greater. So in summary, in this short presentation, we talked about chemotherapy for retinoblastoma, unilateral sporadic retinoblastoma. The age predicts the rate of germline mutation. A little bit on retinocytoma and the risk for transformation into retinoblastoma, and the psychology of retinoblastoma in both the patient and in the parents. Thank you from the laser-focused retinoblastoma team in Philadelphia.